On June the 1st, 2013, President Uhuru Kenyatta announced that the Jubilee Government had abolished maternity charges in public health facilities. In keeping with the promises made by the Jubilee Alliance during the election campaigns, the President said that scrapping off the fees would help all expectant mothers access maternal care and would also help reduce maternal deaths. On the front row, we dissect the state of maternal and reproductive health care in Kenya. 7 years on, are we making the right steps and towards the right direction? To be part of this edition of Front Row, send your questions by logging into slido.com. Enter the event code as #TheFrontRow. We're also available on Twitter at KTNNewsKE. You can also tweet me at Agina Abi, and don't forget to use the #FrontRow. Well, before we kick off our discussion, we want to bring on the stage our panelists for our very important discussion. Are mothers at risk? We start off with our first panelist, and that is Dr. Oluga. He is a medical doctor by profession and currently serves as the Chief Officer of Health in the Nairobi Metropolitan Services. Dr. Oluga previously served as the Secretary General and CEO of the Kenya Medical Practitioners, Pharmacists and Dentists Union, KMPDU. Having held key notable roles nationally, continentally, and internationally, Dr. Oluga is the global co-chair of the Health Workers for All Coalition. Welcome to the program. My second guest, we have Angela Nguku. She is the Executive Director for the White Ribbon Alliance Kenya. She has 14 years of dedicated experience working towards ending preventable maternal and newborn deaths and adolescent health in Kenya, throughout Africa and around the world. Angela has worked for AAHI, AMREF, and as an independent technical and advocacy consultant in the reproductive, maternal, newborn, child and adolescent health program development and management field. She is a passionate midwife who is a member of various task forces and institutions in this area of advocacy. Welcome as well, Madam Angela. Well, to my last guest that we have on the program, Honorable Sabina Chege. She is the woman representative for Murang'a County. She is the chair of the Departmental Committee on Health in the 12th Parliament. Previously, in the 11th Parliament, Honorable Sabina Chege was the chair of the Departmental Committee on Education, Research and Technology, and a member of the Constitution Implementation Oversight Committee. Well, that's a quick snippet of what to expect on this edition of the Front Row. Well, just before we get deep into the discussion, I'd like us to set the ball rolling by walking you through a recent video that captured a woman giving birth on the tarmac outside Pumwani Hospital. Could be a tip of the iceberg of problems bedeviling the country's healthcare system. Industrial action has been normalized, with poor Kenyans who cannot afford private healthcare left to suffer. Our health and science reporter Saada Hassan tells us more.
19th September, a video goes viral showing a woman helplessly giving birth right outside the doors of Pumwani Hospital, where she ought to have been attended to as per the Kenyan Constitution. The husband, Prostin Proches, recounts the events of that day.
Tulifika pale Pumwani, nilikuwa na taxi, pale tumefika, tukaambia masoja, mimi kwanza nikatoka, nikaambia masoja, habari zenu, niko na mgonjwa wako hapa ndani, wakaniambia kwa saa hii hatuwezi fungua gate.
According to the Nairobi Metropolitan Services NMS, the labor occurred on 13th September and an apology statement was issued to the family and Kenyans.
The hospital should have responded. The gate should have been opened for these people to access. There should even have been stretchers, wheelchairs, which we have in the hospital, to take these people inside so that the birthing process is more dignified.
In recent days, a section of women leaders have trooped to the facility demanding for answers. And now, the chairman of the National Nurses Association of Kenya, Alfred Obengo, is challenging the same leaders to formulate better policies if they are genuinely concerned about the healthcare of Kenyans.
I was taken aback personally because our legislators should be helping the executive led by His Excellency the President to implement his agenda. They should be helping him, assisting him through the legislative process, bringing relevant legislations to Parliament that actually are in tandem with the reality on the ground insofar as the healthcare industry is concerned. If they think that there are some loopholes that are there within the healthcare system, let them come with the relevant bills in Parliament to address those issues. But just putting up a mere protest that are going to give sanitary pads and coming maybe a publicity stand, it is not addressing the real problem.
According to Obengo, training of personnel within a health facility will go a long way in helping Kenyans.
You need to train right from that security guard at the gate. They need to be trained on basic etiquette, customer relations, basic first aid techniques, so that they are able actually to help our clients, not just before not even at the ward level or at the clinical level, but even at that site.
Saada Hassan, KTN News, Nairobi.
Well, that report by Saada Hassan kicks off our discussion this moment, and we are really delighted to have a very rich assortment of panelists joining us for this particular discussion. And I'd like to kick it off with Honorable Sabina Chege. Welcome to the front row. And we are at a very interesting time in our history where we have a pandemic. At the same time, health services are stretched. We all saw what happened at Pumwani Maternity Hospital, and there are different quarters in terms of what came out, some condemning what happened, and of course, also the political class being cited as being reactionary. I'd like to get your thoughts as we kick off this discussion.
Thank you very much. It was unfortunate for the incidents of Pumwani. I would want to say that I got my firstborn daughter at Pumwani Maternity Hospital. And so it was sad for me to see a lady on the streets. She was on her way to the maternity, but she didn't make it. Hard lessons for us to learn as members of Parliament, especially myself as the Chair of Health. Yes, health is devolved. We have now the dilemma in Nairobi, whether NMS is under the county or under the Ministry of Health. And so for me, once, I want to really condemn the whole thing, what happened. From the taxi person who drove that woman, I don't know what made him stop before getting to the emergency door, and that was on the streets. I am yet to receive proper information whether the gate was locked and why, who are the security personnel at the site that day, why did they lock the gate, where were the nurses and the midwives and the doctors at Pumwani Hospital. Those are hard questions that Kenyans are asking, but from where I stand, I would want to say we have a fantastic program called Linda Mama, and as the chair, I would expect to Linda Mama from the time she conceives, during the entire process until she delivers, and that is safe delivery, and then we take care of immunization and take care of the infants. What we saw in Pumwani is painful for me as a mother. It's painful for me as a person in charge of health in Kenya. We'll be asking hard questions, but apart from asking questions, we'll also want to know where we would come in and assist Pumwani. Pumwani is one of our facilities that has been there for a very long time. It's a facility that would want to assist whether there is a problem with the health workers, whether there is a problem with the people who are supposed to be working there, whether there is a problem with the management or the problem with the NMS. We'll be inviting the NMS before our committee. We might decide to go and visit Pumwani also. So I would want to say first and foremost, I condemn the incidents. But also the biggest question I ask myself as a Kenyan, where are our values? The person who was recording that video, where was he or she? why were the members of public just looking at that woman? I saw some of them throwing the lassos. Would we have had some people to assist her, carry her, and take her inside the facility? Are we still human as Kenyans?
Okay.
So those are hard questions, but we must make sure that Linda Mama, it's actually do as the name says, in a Linda Mama from conception all the way until she delivers and also takes care of the baby.
Thank you so much, Honorable Sabina Chege. Let me bring in Angela and to just speak your thoughts as well, especially being at the front line when it comes to advocating for maternal rights. What really do you feel as a lady when you see the video that did make rounds? And of course, we've already seen various leaders coming out to condemn what happened. And I just want to get your reactions to this.
I don't know whether you can get me. Can you get me?
Yes, we can. Carry on.
Okay, I think for me, the whole aspect of Pumwani is not isolated. Pumwani is not an isolated case. This is what is happening in most of our health facilities across the country. It just happened that it was recorded and we managed to see what was happening. But I can say that this is not an isolated case. It's something that we've seen across board, across the different counties that we are working in. Our public health facilities have leave a lot to be desired. And as such, I think for us, instead of now starting to say, what is the problem? We need to realize that we are all accountable. If you have a role to play, whether you are the national, the NMS, whether you are the county government, whether you are at Pumwani, whether you are a citizen of this country, you have a role to play. Accountability requires a system-wide approach, especially in maternal health. And as such, it cannot be a blame game at this point in time. We happen to be a country that is very reactionary. We are a country that does not really, let me take you back even before I go to Pumwani. 2 months ago, we had the uproar about teenage pregnancy. Everybody came on board and said, I condemn, I condemn, and condemn. Then what? We moved on, we left. Now we're in Pumwani. I can tell you next week it will be something else and we'll move on. So I think it is us to ask ourselves, where is the problem? When did the rain start beating us? Who has a role to play? And I will tell you, it is all of us happy that we have a role to play. As citizens, we need to understand that we have rights and entitlements, and as such, we must demand for them. As elected members of parliament, as elected governors, as elected people, as people working in the different departments, in the counties, in the national government, we have a role to implement the commitments and the policies that are in place. We have a role to ensure that there's a budget that is conducive enough to be able to have enough health workers, quality health workers, to educate the citizenry on their role and responsibility, and all of us to work together to listen to each other, to ask ourselves hard questions, and at the end of the day, ensure that we actually give that woman, that newborn, the care that she deserves. We cannot continue business as usual. We must stop blaming each other. We must stand tall and ensure that we do what we want to do to get it right for our mothers and newborns.
Thank you so much, Angela. And let me bring in Dr. Oluga. And of course, by all accounts, what happened at Pumwani was an unfortunate incident. And like Angela says, it's no longer about a blame game, but what is the best way forward? Dr. Oluga, sitting as the Chief Officer of Nairobi Metropolitan Service, and clearly there is a question of access to public health facilities, as well as the personnel. Had the security firm had emergency skills, would this have been ended? Would this have ended differently?
So thank you, Abby. First is to to really echo what the chair of the Parliamentary Committee for Health has said, that it boils down to our humanity as Kenyans also, and I think she's mentioned a number of issues that we should take seriously. One is the fact that even when the person who is recording the video, there was a lot of people who are there on the streets, and they were very, from account of the video and by studying it keenly, there was very little attempts to help the woman, and that is not to absolve the blame or to say that the facility was right. Actually, NMS, we have been very clear that the incident is really regretted, and I think we've given this account, including to the Senate Committee for Health that came yesterday. We have visited the lady, we have talked with the husband, we made sure that we admitted her, and that the mother and the child was safe. But going to really what should have happened, and I don't think that this, in my opinion, is a policy issue, and I don't think that it's more of an what I would call an isolated incident. From April, we have really tried our best amidst the COVID pandemic to make sure that Nairobians are receiving the best care in terms of maternity, but not just in maternity, in continuation of services. Remember, Nairobi was seriously affected by COVID. We had 60% of all COVID cases were in Nairobi. Out of the many cases that we recorded, nearly 20-something thousand were in Nairobi. And from April 28th, when we realized that facilities were getting overwhelmed, and because of COVID, we put in a few measures just to make sure that reproductive health care and maternity in specific is not affected. So one of the first things that we did was to sign up a partnership with Bolt. Bolt is one of the technology taxi services in Nairobi. And what we were doing is to make sure that any woman who could not access facilities because of the curfew could actually call, and the number was provided, the number that they could call for free. And so far we've received over 30,000 calls. And out of those 30,000 calls, 478 taxi services have been given to benefit 1,380 mothers. So I just wanted to bring that into context so that even as we discuss a very unfortunate incident and we condemn, which we all do, and as we have apologized, also to look at it as an isolated case and not necessarily as a policy gap. And in fact, for us as the Nairobi Metropolitan Services, we've made sure that we are even doing way more in terms of our ambulatory services. We had 5 ambulances. We've made 226 trips, ambulatory services just for maternity every month. And we try to do up to 24 outreaches every week in the informal settlements just to go and talk to these mothers. Even ANC, because facilities were getting congested and because of the fear of COVID, we decentralized some of these services to the sub-county in Kibra, in Mathare, in Korogosho, within the community. And we've worked very closely with some of the religious leaders. Thank God the churches were also, they were close. So we were working very closely with religious leaders within the community to make sure that we are reaching out to the community through our community strategy. So basically, this is just to buttress the point that the Pumwani incident is an isolated incident. It's very unfortunate. It should never ever happen. And I know you just played the clip where we said there that our response should have been quicker. Of course, all our facilities are open. Pumwani, we do 80 to 100 deliveries every day, nearly more than 2,000 every month. And it's a very busy facility. And for the last 3 months that we've been there, there's only one maternal death, only one death, and in circumstances that could not be prevented. So even as Kenyans look at this particular case, I think they also have to look at Pumwani as this busy facility that is the only referral hospital in this country that is specific to maternity, and the efforts that we have put in to really make sure that that facility we change the brand. And I think one of the pleas I had also for the media, that the 65% of Nairobians depend on public health facilities. And when we brand these facilities inappropriately, or we change the perception of care in these facilities, then we are actually in ourselves hindering access to care, because then women such as Jacqueline, they may fear to go to the hospitals early, Because I have gone to, I had the privilege of visiting her, and she lives 3 minutes to the hospital. And as unfortunate as this incident took place, and I think this should never have taken place, but I also want to say that unless something was also abnormal with the labor, we would have expected her a bit earlier in the facility, because normal labor takes about 4 to 6 hours, you know. So there's a lot to be discussed here, and I think that for us also we are going to be looking at the opportunities of improving, including training of healthcare workers. But all in all, we condemn this incident, and we are taking very serious measures, as we have already promised the public, to make sure that no such thing is repeated.
Thank you so much, Daktari. Well, very interesting remarks coming out in regards to what happened at Pumwani. And ladies and gentlemen, we want to go on a quick commercial break. When we come back, we want to expand this conversation further and just talk about the road ahead when it comes to universal health coverage in the country. The maternal health care facilities are literally on their knees when it comes to the ability and capacity to handle the swelling numbers. We'll be discussing this and much more after this quick break.